Thank you, Carl. Well, almost half of all Australians aged over 65 were found to be frail or what's called pre-frail in a new study by aged care provider Benetas. Today, medical expert Dr Ross Walker is here to take us through the findings. Dr Ross, good morning to you.
Morning, Georgie.
Just define frailty, and how do we know if someone is frail or pre-frail?
Well, frailty is basically a heightened risk of illness or injury, even brought on by a small stress. So that's frailty itself. But how do we know? There are 5 criteria. Number 1, F is for fatigue, so people say they're tired most of the time. Number 2, R is for resistance. It means you can't walk upstairs or get out of a chair properly. The A is for ambulation or walking. Can you walk a block? The I is for illnesses. You have to have 5 or more illnesses to be in this category. And the L is for unexplained loss of weight. And so if anyone has 3 or more of those, they're defined as frail, but only 1 or 2 of those, they're pre-frail. So it's pretty simple to figure out whether someone's in that category, and it's really important because the figures are so high.
I was about to say, what does this tell us about the state of older Australians?
Well, it tells us that older Australians often aren't that well, and so we need to do something about it. We really do.
And give us some tips. How can we prevent it?
Well, the important thing, firstly, is exercise. How often do doctors say exercise is important? And I say to people, the Walker suggested dose is 3 to 5 hours every week of exercise, where it should be about 2/3 cardio, running, walking, swimming, cycling, or some form of cardio, and 1/3 resistance training. And then, secondly, what we need to do, we need to look at our diet, especially the Mediterranean diet, and a lot of good protein. Number 3, a lot of people are on medications, and some of those medications, for example, statin drugs to lower cholesterol, can affect your muscles and your strength and your fatigue. Number 4, keep up your vitamin D levels. And number 5, there's a supplement called Ubiquinol that's really good for energy. If you do those 5 things, you can certainly increase your ability to get over frailty or even pre-frailty.
Well, we're an ageing population, aren't we? So that's good advice.
Oh, certainly.
Yeah.
Yes.
Ross, good to see you. Thank you so much. Time now for the sports headlines. Here's Tim.